A patient has been found collapsed and in need of emergency assistance. Ensure a safe approach. Look for hazards such as spilt water jugs or trailing cables. Check for response. Place a hand on the patient's head and shout loudly in both ears whilst tapping their shoulders. If no response, shout for help and pull the emergency bell if one is available. Open the patient's airway using head tilt chin lift. Place one hand on their forehead and 2 fingers under their chin and tilt their head backwards. Check to see if the airway is clear. Look for signs of normal breathing and check for a carotid pulse simultaneously, only if trained to do so. Do not put your face near the patient's face to listen, feel for breath. Take no longer than 10 seconds to check for signs of life. When help arrives, if they are donned in full aerosol generating procedure PPE, instruct them to commence chest compressions. The initial responder must then go to phone 2222.
Adult resuscitation team to Ward 10, first floor.
Locate the lower half of the patient's sternum, centre of the chest. At a depth of 5 to 6 centimetres, rate of 100 to 120 per minute, compress the person's chest. Ensure full recall after each compression. Obtain the bag valve mask and connect to 15 litres of oxygen. Using a 2-person technique, give the patient 2 breaths, each breath given over 1 second. Continue CPR at a ratio of 30 to 2. It is important to change the person doing chest compressions at least every 2 minutes to avoid fatigue. When the porter's grab bag arrives, obtain the CPR meter and place on patient's chest. This will assist in achieving good quality chest compressions. If trained in defibrillation or when the resuscitation team arrive, the priority is to attach the defibrillator and proceed with advanced life support. It is important to remember your personal protective equipment. Follow the current local and Resuscitation Council UK guidelines for current PPE requirements for resuscitation attempts.